Hey everyone, and welcome to Bioscan Hub. We're all about helping you nail those core concepts in medical science. If our explainers help you out, do us a favor and hit that subscribe button. It really helps support the channel. Today, we are diving deep into a skill that is, no joke, the foundation for pretty much everything you'll do as a medical lab student: mastering blood specimen collection. We're not just going to go over the steps, we're going to understand the why behind getting that perfect sample every single time. Honestly, this is the bedrock of diagnostic medicine. So what's the difference? It's everything, absolutely everything. The skills we're about to cover are that critical link between a patient and the answers they need from the lab. A correct diagnosis, an effective treatment plan, it all kicks off with one thing: a high-quality specimen. If you get that wrong, the whole process can just fail right at the starting line. Okay, so to really get why the collection process is so meticulous, we have to respect the material we're working with. Blood isn't just some red liquid, It's the body's diagnostic blueprint. It's like a living document that gives us a real-time snapshot of a patient's health. The average adult is walking around with about 5 liters of blood, and that volume is basically split into 2 parts. You've got about 3 liters of the fluid part, which we call plasma, and then 2 liters of cells, which are mostly made in our bone marrow. And within those 2 liters of cells, you've got the major players. You have erythrocytes. Those are your red blood cells carrying oxygen. You've got leukocytes, the white blood cells, our infection fighters, and thrombocytes, the platelets that are absolutely essential for clotting. Every single test you're going to run is designed to analyze these guys, which means keeping them in perfect condition is your #1 job, period. And that brings us to the villain of our story, the bad sample. Every single step, every alert, every single procedure we're going to talk about is designed to defeat this one enemy. Because a bad sample isn't just an oopsie. It's a real risk to patient safety, and it's a huge waste of time and resources. This chart right here lays out the stakes perfectly. A great sample is properly mixed with an anticoagulant. But if you fail to mix it, or you're too rough, you get clots, and boom, the test is useless. For coagulation studies, if a tube isn't filled all the way, that blood to anticoagulant ratio gets all messed up, and your results are completely invalid. And then there's hemolysis. That's when red blood cells literally burst open. They spill their guts, things like potassium, into the plasma. This can make a patient's potassium levels look dangerously high, leading to a totally wrong diagnosis. And of course, the worst one, improper ID. That's a direct patient risk. So knowing how these bad samples happen is the key to stopping them. Improper patient ID is obviously a catastrophe, but look at the others. Drawing tubes in the wrong order, that can cause cross-contamination, where the additive from one tube messes up the next one. Using a needle that's too small can act like a tiny shredder on red blood cells. Every single one of these is preventable, and we have to be on guard. So let's start building our defense against these errors. We're going to start small with the capillary puncture. This is a procedure where it's all about absolute precision, getting just a few perfect drops of blood. The procedure looks simple, but every little detail matters. So first, select and disinfect your site. Fingertip for adults, heel for infants. The puncture itself is key. Sterile lancet, go perpendicular to the fingerprint lines that helps the blood form a nice bead, and never deeper than 2 millimeters. Now here's a super important step. Always wipe away that first drop. Why? Because it's full of tissue fluid and alcohol, which will totally mess up your results. After you get your clean sample, just apply some gentle pressure. And here is a core rule you have to burn into your brain. If the blood isn't flowing well, it's so tempting to just squeeze the site. You can't. Don't ever do this. Squeezing literally forces tissue fluid into your sample, which dilutes the blood and makes the test results worthless. And that just means a painful restick for the patient. A way better move is to gently warm the hand a bit beforehand to get the circulation going naturally. Okay, let's level up. Time to talk about the true workhorse of the lab, venipuncture. This is by far the most common way we get blood, and it lets us get the larger amounts we need for that huge menu of tests. Mastering this is just not optional. The order of operations here is everything. You apply the tourniquet, you pick and clean your site, you anchor that vein so it doesn't roll away, and then you perform the puncture. Once this tubes start filling, you hit the most critical sequence of all. Release the tourniquet before you pull the needle out. If you forget, all that pressure from the tourniquet will force blood out of the vein and into the tissue, causing a really nasty, painful bruise called a hematoma. And while we're on the topic of tourniquets, here's a hard and fast rule.
It cannot be on for more than 1 minute. That's it. Any longer and you get something called stasis, where blood just pools in the vein. This leads to hemoconcentration, which is when the liquid part of the blood actually seeps out into the tissue, leaving behind a thicker concentration of cells and proteins. It's like a traffic jam. Everything gets backed up, and your sample ends up being falsely dense, giving you inaccurate results.
And here's another absolute never ever. Never draw from an arm that has an active IV line. If you do, you're not sampling the patient's blood, you're sampling the IV fluid. The results will be completely wildly wrong. If you are in a situation where there's absolutely no other choice, the draw must be done at a site below the IV. That way you're getting venous blood before it gets diluted by all that incoming fluid. All right, on to our final and most advanced technique, the arterial puncture. This is definitely a higher risk procedure, and it's usually done by specially trained staff. But it's for a high-reward sample that we need for specific tests, like arterial blood gases, or ABGs. Arteries are high-pressure vessels, so the rules for picking a site are super strict. The number one most important requirement is that there's proven collateral blood flow. What does that mean? It means there's a second artery supplying blood to that same area, kind of like a backup generator. It's a critical safety net. If something happens and the punctured artery gets damaged, that collateral artery makes sure the tissue, like the hand, still gets all the oxygen it needs. So, how do we check for that collateral circulation before we stick the radial artery? We use something called the modified Allen's test. You have the patient make a fist while you press down firmly on both the radial and ulnar arteries at their wrist. Their hand will go pale. Then you let go of the pressure on the ulnar artery only. If color rushes right back into the hand, that's a positive test. It means the ulnar artery is doing its job and can supply the hand all by itself, so it's safe to proceed with the radial puncture. What you do after you get an arterial sample is just as important as the draw itself. See, the moment that blood leaves the body, its cells are still alive, still using up oxygen, which would completely change the blood gas results. So, you have to immediately put the sample into an ice slurry. That slows everything down, basically putting the cells to sleep and keeping the sample stable for about an hour. If a sample isn't put on ice, it has to get to the analyzer within minutes or it's got to be thrown out. So we've walked through 3 totally different procedures, but you know what? They all share a set of universal principles. Let's boil it all down to the core pillars of a successful blood draw. This is the stuff that will build your confidence and, more importantly, your confidence. Think of these pillars as your mental checklist for every single draw you ever do. It always starts with the patient. Meticulous, 2-factor ideas non-negotiable. Then it's all about your technique. Correct site prep, handling your tubes right, and sticking to the procedure every time. And it doesn't end when the needle comes out. It's about great patient care and getting that precious sample to the lab ASAP. These aren't just steps, they are a mindset. And mastering them is what makes someone a true laboratory professional. And that really brings us to the final thought. We've gone over so many little things that can go wrong, from how long a tourniquet is on to not squeezing a finger stick. The goal is to make preventing these things second nature. So, as you head into your practice, I want you to think about this. Which one of these errors are you going to be obsessed with preventing? Answering that for yourself is the first real step toward becoming an exceptional practitioner.